Well, as you know, the coronavirus can infect anyone, but among the most vulnerable targets are millions of chronic pain patients. In Nevada and elsewhere, regulators have eased some of the strict rules that govern how pain medications can be dispensed during the health crisis. George Knapp of the I-Team has the story.
Tens of thousands of Nevadans are among the 20 million American chronic pain patients who are terrified of COVID-19 because their immune systems are already compromised due to deadly diseases, severe injuries, and other ongoing medical conditions. Because of the opioid crackdown started by the CDC in 2016, pain patients have been denied care, tapered off their medicine, kicked to the curb. Millions have suffered in silence. Others have taken their own lives as a last resort. Some have turned to illicit street drugs, which have caused overdose deaths to spike even higher. Dr. Dan Laird, a pain specialist and attorney, said this about the risk factor for his patients. These are patients who live under constant distress due to their pain and because of the discrimination they receive from the healthcare system, pharmacies, and government. Many have serious illnesses and complex medical history, so we see them as being at increased risk to infection from coronavirus. For pain doctors, it's almost as bad. Threats of DEA raids and pressure from state medical boards in the last 4 years have caused many pain doctors to retire or change to another specialty. The end result is there are far fewer pain clinics and pain specialists in the U.S. than 4 years ago, though severe pain caused by accidents or diseases has not taken a holiday. A typical pain patient is required to show up every month at pain clinics, often packed with other patients. They interact with medical staff, undergo exams, take monthly urine tests, and in the end can get no more than a 1-month prescription, some no more than a week's worth. During the coronavirus scare, this system is highly risky for patients and for medical staff. Pain doctors recognize that offices packed with immune-deficient patients is a recipe for disaster, so as of this month, they've initiated changes in how they do business. Pain specialist Dr. Dan Burkhead, president of the Clark County Medical Association, told the I-Team that physicians must do everything we can to minimize a high concentration of people in waiting rooms. Another prominent pain physician, Dr. Stephen Gephardt, said his practice stopped requiring in-person visits earlier this month in favor of telemedicine, so they don't have to report to a clinic during the viral pandemic. We're doing our best to keep both patient and our employees safe, Gephardt told us. The American Medical Association issued an advisory opinion in March stating under the circumstances, telemedicine is advisable for pain physicians because it's consistent with social distancing guidelines. To the utter amazement of pain patients, the DEA issued a similar statement. On its website, DEA granted exemptions to its strict rules about opioid prescriptions, authorizing the use of telemedicine for as long as the health emergency is in effect. For pain patients and pain physicians, it's the first good news they've heard from DEA in years. George Knapp, 8 News Now.
Now, we do have links to the AMA and the DEA statements on our website, along with our previous reports on how the opioid crackdown has affected millions of chronic pain patients.